Go. Okay. Global perspective on mental disorder. Mental disorder is typically more pronounced in modern industrial societies like the United States and Western European countries, as opposed to countries like China and Nigeria. One of the major reasons for this is because countries like the United States focus on individualism as opposed to collectivism. By focusing on individualism, people don't have the same support networks as do traditional societies that are based on the group collective. Some types of mental disorder appear in some cultural societies, but rarely if ever appear in others. Although there may be differences between societies in types and symptoms of mental disorders, there are also similarities. One common theme is that women are more likely than men to suffer from anxiety and depression, men are more likely to suffer from substance use disorder, and young people are more likely to suffer from mental disorder than older people. Societal responses to mental disorder. In order to gain a thorough understanding of mental disorder, we have to look past the problem. It is important that we as a society focus on how mental illness is perceived, because the perception has a huge impact on the lives of those who suffer from mental disorders. A little bit about historical background. In ancient Greece, mental illness was viewed with amazement. Philosophers like Socrates believed mental illness was a blessing and an individual with mental disorder should be thankful. Historically, throughout human existence, the mentally ill have been treated extremely bad. For example, in the Stone Age society equated mental illness to having an evil spirit inside one body. During the Stone Age, what was equivalent of a lobotomy today was conducted on many individuals suffering from mental illness, where a hole was bored into the skull of the afflicted to allow the evil spirit to escape. The evil spirit continued to be considered the cause of mental illness in early Hebrew civilization. The fear around mental illness is reflected as well in the Bible. The rationale gives the foundation in which the burning of witches started in medieval Europe. The church defined mentally ill as witches who had evil spirits or the devil inside their bodies. During this time, there were very limited places that treated mental illness. One of the earliest hospitals known for treating mental illness was called the Bethlehem Hospital in London. Patients were reported to have been chained to beds and even displayed for the amusement of the public, where tickets were sold much like a circus sideshow. As the 17th century closed, a change in attitude towards the mentally ill began to occur. This was most notably due to the work of Dr. Philip Pinel, who was in charge of a large asylum in Paris. Dr. Pinel began to administer what became known as moral treatment. Moral treatment entailed treating patients as human beings and encouraging them to believe in themselves. As a result of his revolutionary treatments, many patients became thankful. Some were even reported to have been released back into the public after decades of being hospitalized. Eventually, many of these asylums were turned into nothing more than storage warehouses for the mentally ill. Fast forwarding to the 20th century, conditions once again began to improve due to the opening of general hospitals, private psychiatrists, private clinics, and community healthcare centers, which offered more therapeutic options to treat mental illness. The public, one of the biggest obstacles to treating mental illness was and is the public's negative attitude towards those suffering from this affliction. Although perception is growing positively by leaps and bounds, mental illness is still frowned upon by many vehicles that show mental illness as a negative, such as stereotypical jokes, popular TV shows, even presidential candidates making derogatory comments about mental illness. The court. As stated earlier in the text, the public does not appreciate having the mental ill free to roam around, so the court places the mentally ill in institutions or prisons. This is achieved by 1. Involuntary commitment proceedings, 2. Denying the right to trial, and 3. Allowing the defense of insanity. Involuntary commitment. Under this provision, the court can hospitalize the mentally ill against their will for an indeterminate amount of time, from a few days up to the rest of their lives. Under this provision, individuals can only be released after convincing the authorities in charge of the institution that they have recovered from their mental illness. The second, denying rights. The court can confine mentally ill people by denying them the right to be tried. It is a fundamental right as a citizen to stand trial if one is charged with a crime, but if you're mentally ill, you don't have that right. The court does this by stating that an individual is not mentally fit to stand trial. Thus, mentally ill people without the benefit of trial can presumably be placed in mental institutions for an indefinite period. The insanity defense. Under this defense, the courts cannot put mentally ill persons in prison for a crime. If a defendant is judged insane, the defendant is sent to an institution. If they are not judged insane, they are sent to prison. There are 2 major rules for establishing the insanity defense. The first is the am not rule, which states the accused is insane and therefore not guilty of the crime because they did not know it was wrong. The second is the product test, meaning that at the time the mentally ill person committed the crime, it was a product of their mental illness. Mental hospitals. The mental hospital is a total institution where individuals are cut off from greater society and live structured and closed lives. Historically, the smooth operation of the facility takes precedent over the needs of the patients, and employees have in most cases treated patients more like objects than humans. State-run facilities have been reported to be extremely bad. In most cases, the inside of these places reported to reek of urine and cigarette smoke. There have been reports of patients being tied to bed, sexual abuse of female patients, and over-medicating patients. Due to budget cuts, most of these social programs and institutions are being closed for lack of funding. We as a society see many of these dangerous mentally ill patients being released back into society, becoming homeless, vagrants, and drug addicts in our community streets. The Community Health Center. Community health centers were initiated in the 1950s. Congress allocated funds to help states provide community mental health centers. As a result of these initiatives, mental health centers exist all over the country. The object of these centers is to offer professional help through various resources such as hospitals, courts, police departments, welfare agencies, schools, churches, employers, co-workers, neighbors, and other concerned citizens, all in a concerted effort to help the mentally ill. One of the most important things about these centers is the option of either doing inpatient treatment or outpatient treatment. Allowing patients to do outpatient treatment takes some of the stigma away from seeking treatment itself. Also allowing patients to have as little disruption to their normal routine as possible, as well as utilizing family and friends, which has proven to be very effective. This type of treatment has become known as network therapy because it uses the network of family and friends to help treat the mentally ill. One thought as to why this network therapy is so effective is because people engaging in this form of treatment are usually friends, family members, or people that aren't necessarily professional clinicians. Bringing the aspect or dynamic to the treatment arena allows the individuals to help people on a more empathetic and personal level, as opposed to a professional psychiatrist who might treat a patient more like along the lines of a medical doctor treating a physical ailment, instead of providing the necessary emotional stability and support needed to be more effective.